Hi, I'm Mary Catherine Beach, Professor of Medicine and Course Director of Scholarly Concentrations. I'm going to talk to you now about introducing your research question or aim, and in particular, how to make a three-point introduction. So, introducing your research question or aim is one of the most important things you can do. And there is actually a formula you can use that will, I think, get you very close to something interesting every time if you follow it exactly. Once you learn the formula, you're free to improvise and do more creative things. But I think forcing yourself into this formula for the introduction of your abstract or your paper, or even just when you're talking to people, will help you a lot to build the case for your research question. So the 3 points are: what is the general problem or current situation? What is the specific problem or controversy that you're going to address? And then how does this study help? So you might say otitis media is one of the most common reasons that children receive antibiotics. Many patients who receive the diagnosis of otitis media have no microbial evidence of infection. So to better delineate the vagaries of the otologic examination, we studied the inter-observer variability in the diagnosis of otitis media. So as you can see, your research question is to figure out whether people can do an otologic examination with any kind of reliability. And so you want to introduce that research question by explaining why that might even be important to look at. So that's the basic idea. Here's another example. For the general point, evidence is accumulating that carotid endarterectomy reduces stroke risk in many patients with carotid stenosis. The specific problem or controversy is that despite increasing information, decision-making about carotid endarterectomy remains difficult. And how is this study going to help? Well, to help clinicians assess the relative benefits of carotid endarterectomy, we calculated the number of operations needed to prevent one major stroke or death under different conditions. So you can see that that's how the author builds the case for why it might be important to know how many operations are needed to prevent one major stroke or death. Why would we want to know that? Well, we'd want to know that because it can help us make decisions about whether carotid endarterectomy makes sense for a person. Okay, one more example. The current situation or problem, diabetic nephropathy, is the most common cause of end-stage renal disease. The specific problem or controversy: although screening for microalbuminuria is recommended for all diabetic patients, many physicians do not comply with this recommendation. So to investigate a simpler strategy for diabetic nephropathy, we used a decision model to simulate the effects of treating all patients with angiotensin-converting enzyme inhibitors. So I think you get the point of how this should work, and you'll learn how interesting it is when you try it for your own research question. So let's think about what is your research question or aim, and then you can work up to how you would lay that out in 3 points. So we're going to let you have a few minutes to do this on your own. I want everyone to write down your 3-point introduction, 3 sentences right now. Just for your information, you can take those 3 sentences and then basically craft a 3-paragraph introduction to a manuscript if you want to go that far. But the 3-point introduction is usually just 3 sentences that hit the main points. So go ahead, work on yours, think about what your specific study is going to do, and then what controversy it addresses and what the general problem is that you're trying to help, and then lay out the logic that way. And then we're going to talk about it while you give me your examples after this.